Not in Malaysia, overseas. Those who have brown eyes, they want to look blue eyes. Some centers in Europe have done it, but they are not approved by the association.
I see. So what are they doing?
They are lasering.
The biggest problem in our country is that.
So menjaga mulut ni adalah satu keutamaan.
You want to be a good doctor, sesuatu berlaku depan mata je. So what are they doing?
They are lasering the cornea. This causes scarring, so the light that comes doesn't reflect through the iris, so they look blue color. You know, I've seen one patient from Italy. She came all the way for work here. And I said, "Why did you do this?" "Oh, I want to look blue." Her eyes was brown, you know. So macam-macam lah, you know.
And dari segi lifestyle, maksud saya kesihatan rakyat dari segi satu pengamatan all these technological devices, handphone, laptop, FT katakan lah, lepas pasca pandemic ni, work from home becoming a synonym. I mean, younger kids are being exposed to gadgets earlier than ever.
Correct.
Are you all seeing a trend that is having concerns with eye issues at the moment? Dryness or vision impairment?
Okay, nowadays even IT people adopt.
Episod kali ini dibawakan khas oleh Symnia. Symnia merupakan salah satu produk kesihatan yang digunakan untuk orang-orang yang mengalami masalah tak cukup tidur ataupun tidur yang tidak lengkap. Ia merupakan produk tradisional. Antara ingredient yang dikandungi ialah ashwagandha dan juga Apocynium venatum. Dia merupakan satu ekstrak daripada daun dan tumbuhan. Jadi kepada sesiapa yang inginkan produk sebegini, boleh mengunjungi doktor-doktor berhampiran dan klinik-klinik berhampiran anda untuk bertanya lebih lanjut tentang Symnia.
Adults pun long hours in computer, screen, semua 8-10 hours per day. We always tell them the 20-20-20 rule lah. Okay,
what is that?
Okay, 20, that means 20 minutes of screen, close your eyes for 20 seconds, count lah 1, 2, 3 until 20, then blink your eyes 20 times. Okay, look far away, 20 meters. If you can do another 20, take 20 steps around your office and come back. That's the easiest way to remember.
So 4 20s,
4 20s. Of course, sometimes you can't do 20 minutes. Every half an hour or at least 40 minutes, take a break lah. Basically, I always tell patients, you want to go for a jog. Can you run non-stop for 8-10 hours? No, right? You have to stop halfway, let your legs rest for a while. So same thing with your eyes. You half an hour, 1 hour, close your eyes, rest lah. Look far away, look somewhere in the greenery, look in the jungle, look into the sky. Then once you're relaxed, then respect with your screen. Okay, then other thing, environment, you cannot forgo aircon, but the blowers, make sure it doesn't blow the aircon directly on your face. Make it on the side or behind you. Okay, so that also causes less dryness. And for ladies, of course, we say less makeup unless you have to go for some function and all that. Okay, then same thing when you're driving your car, let the blowers don't blow directly into your face, but on the side. So these are the small tips that you can do. Okay. Then coming to all this myopia, short-sightedness in children, I always tell parents, let the kids play in the sun more. Okay. These are studies done. Okay.
I like these studies. Please tell us.
So kids that play more in the sun, hot sun, our body releases this dopamine. Okay, it's a hormone in our body, and this dopamine reduces the elongation of the eye. So the less the elongation of the eye, the less the myopia. Okay, that's why you see in the kampung-kampung, the boys play in the beach lah, play kites or cycling and all that. Most of them don't wear glasses. But those in KL play football also, futsal indoor. Badminton pun indoor badminton. Semua indoor. Never go exposed in the sun.
True.
So try to expose them more in the sun. Don't worry about getting darker and all that. No lah, Asian hitam lah nanti.
Understand.
Don't worry about that.
I think itu memang satu masalah. Bukan hanya pada efek pada mata, dan juga kita lihat pada impact vitamin D.
Yes.
Vitamin D studies, if we were doing tests in our clinic, we see the levels of vitamin D, especially among female, is very low.
I see.
And very, very low. So you must understand that, of course, you can consume vitamin D as a supplement, but the basic vitamin D source is sun exposure.
I see.
So the basic sun exposure. We're saying an advisory level is to have between about 75 to 150, a good level of vitamin D. We're saying less than 45. Wow. 30 to 45 is like an average among our females. And you must understand, like the same thing we talk about dopamine, it's going to be the same thing. How we look at melanin production, melatonin also, we're looking at how much of reflective light we're having, how much of this kind of high beam light, intensive light exposure. We've got all of this AMOLEDs that people are using they are dimming the lights before they sleep, but the light on their thing is very, very bright. So it's actually a pathway through our eyes, right to our pineal gland in our brain, and it's activating that system. So the stress, when you look at dopamine, is much more exciting kind of hormone. Here we're looking into the cortisol and the stress level. So they are doing this, what we call as a doom scrolling. They keep scrolling, and with a strong light, they don't get to sleep. Their melatonin doesn't kick in at night, and melatonin and cortisol has this chiasmic position, so it affects their thing. That's just very interesting when you mention that the relations to the sunlight to the kids. Doc, I want to ask you again a bit on going back to you talk about we talk about lifestyle. Is there any we see these products in the market, a lot of focus on antioxidants to be specific.
Correct.
Kita bincang tadi sedikit tentang hidrasi, pentingnya sometimes moisturization kepada mata. Okay, hidrasi kepada mata, kita gunakan beberapa produk macam mengandung hyaluronic acid, saline dan sebagainya kan. Antioxidant ni pun jadi bagi saya satu bite ataupun one exciting segment of ophthalmology these days, where we see a lot of products talking about like, you consume this kind of antioxidants, you akan dapat better eyesight, more brighter eyesight. I want some input from you as a specialist.
Okay, I would say like things like all these berries, blueberries, all that is good for the skin and the eye. Okay, it increases the blood flow around the eye. So people with dry eyes, sometimes we say take a lot of blueberries. It's good for the eyes. Okay, things like lutein, zeaxanthin, those you buy in the pharmacy, those are more for the retina. Okay, but our food like bayam, kangkong, broccoli, egg yolk has a lot of lutein and all that. So consuming all this also is good for the eyes already. But berries and all that is good for the more for the blood flow around the eyes, and it's good for dry eyes also. No harm taking. But if you buy all these supplement online, this from Japan lah, from here lah, from there lah, we don't know what's the kandungan. I would
not advise like that lah.
Why don't you just buy the original fruit? That's all I always tell. You pay like 100 ringgit for this supplement, don't know what's the kandungan. Why don't you just buy 100 ringgit of blueberries and just eat it up? Why not? True. Get the original one rather than
the fresh option.
Fresh option, yes. So I'm not against supplements per se, because there are some old people who can't buy, they don't have teeth, they want liquid stuff. Okay, no harm. But the rest of us who have normal teeth, we can eat the fruits, exercise. Why not just take the natural?
But nowadays, we have this phenomena of people want to be very specific and terrific. Like example, like when we talk about like berries, they want to go zoom in. Like I want to know how much of bioflavonoids are there, whether got resveratrol, whether got this, whether got that. You know what I mean. And then industry also, they are very cheeky to come out with things that will fascinate us. In fact, like maybe like one item will have like let's have hyaluronic acid, let's have some bioflavonoids, let's have some creatine, and then there's
forget about that lah. They mean vitamin C last time 500, now 1000. So
you can even go higher than that.
Yeah. So why not? I always tell my patient, take the middle lane. Okay. Don't take too much of anything. Too much of anything also is not good. Okay,
be moderate.
Be moderate. Moderate is the best actually. Okay, so if you want to take something good like water, also you take too much also is not good. Too little also not good. So you take moderate amount of water, moderate amount of fruits, moderate amount of exercise, vegetables, everything moderate. Okay, don't overtake anything too much. Same thing with supplements. You want to take 1 tablet a day? Oh, the kotak says take 3 tablets. I say, yeah, but if you're in Africa, no food, okay lah, you take 3. But in Malaysia, you have food. You have so much of natural thing coming from your food. Just take 1 enough lah. So that's how I would say.
That's a decent advice. And hydration wise, any studies you want to share like how important hydration is going to be for eyes?
But I can't say offhand. I know some people say drink 5 liters of water lah. Then I also read some people say don't drink too much of water. Whenever you are thirsty, you drink. If you are not thirsty, you don't have to drink. There are people they'll carry one big 5 liter of water and they'll say one day die must drink this per day. I'm not that type of person. I would just say drink as much as you can lah. So I think, as I said, moderate is the best.
And like using like artificial teardrops and everything, how much benefit is something like that for people who are actually constantly exposed to like they are perpetually working on screen? I think
it's no harm putting artificial tears, because end of the day they're not medicated, they're just a lubricant only.
Okay.
So for me, you put like 3-4 times a day, 10 times a day, 100 times a day, it doesn't matter with me. Okay, but if your eyes feel dry, put it lah. If your eyes feels okay, not so dry, we don't want to put also, I'm okay with that.
Understand.
Okay. But people who have done LASIK or any refractive surgery, sometimes they are a bit malas to put drops and ointment and all that. I would say, every night you brush your teeth before sleeping, right? Why you want to brush your teeth? Because you want to jaga your teeth, right? You want your teeth to go rosak before you go see a dentist. So same thing with your eye. Maybe once a day or twice a day, just put something to just lubricate your eye lah. No harm done. Why wait until it's something worse than only?
True. Yeah. So with those with refractive surgery, it's something that highly advisable lah.
Yes, normally we will say at least the first 3 months after LASIK, put the artificial tears. Maybe the first month you put like 4 to 6 times a day. Second month maybe 3 to 4 times a day. Third month maybe 2 to 3 times a day. Slowly taper it down. But if your eyes memang dry before that also, you put as much as you want. No harm done. Of course, there are other dry eye treatment available, not only artificial tears, but those are for those severe cases lah. Those like biasa, like normal people, normal artificial tears is good enough already. Yeah.
Understand. Okay. Just few more questions to ask regarding like when we see this technology LASIK ni, adakah teknologi ni hanya wujud di pusat perubatan swasta ataupun dekat pusat perubatan am? Hospital kerajaan pun rawatan ni disediakan.
Okay, kalau LASIK biasa kat swasta saja, sebab mesin tu mahal. Okay, sampai berjuta-juta. So I don't think so government hospitals do it, because they treat more for diseases, whereas this is more of a lifestyle thing. Okay. So
it's not aesthetics, tapi dia lifestyle.
Yes, correct. Okay. So most of them I would say is in private.
Yeah. Okay, so siapa-siapa yang berangan untuk dia kena jumpa doktor-doktor dekat private saja buat masa ni lah. Tapi mungkin kita tak tahu, mungkin pada waktu akan datang this kind of technologies akan di-adapt kepada sistem kesihatan awam. And dari segi cost, okay, biasanya lepas kita bincang-bincang, cost akan jadi satu faktor. Satu, what's the average cost untuk buat rawatan seperti ini? Kedua, adakah rawatan-rawatan ni juga boleh diklaim menggunakan sistem insurans dan sebagainya?
Okay, insurans memang tak boleh, sebab this insurance they will say lah, you boleh pakai spec, why you want to do this surgery?
Okay. You want to minimize the cost lah.
Yes, and some they say, it is not macam terdesak, or it's not an emergency that you need to do surgery. So memang insurance tak boleh.
It's not a disease lah, technically.
It's not a disease. It's your lifestyle thing. So insurance you can't claim for refractive surgery. Okay. Cost wise depends. Okay. Macam LASIK, it's anywhere between 4,000 to 6,000 per eye.
Ringgit.
Ringgit. Yes. Because LASIK also got 2 types. There's one, the basic LASIK at our center, and there's another one we call it the more advanced LASIK lah. Okay, so depending on which package you take.
Apa beza this two?
Okay, the basic ones, the power we follow our optometrist finding. So what I do to the patient is still same, still femto LASIK. Okay. If you take the comprehensive one, that one the patient will go through another test. And is normally recommended for people with higher power. Let's say your power is more than 600, your astigmatism is more than 1.5 diopter, then I would say go for the customized LASIK. So customized LASIK, the difference is they go through another test called the eye design. Okay, eye design is like a machine that this thing called wavefront technology. So it detects your astigmatism more thoroughly. Normally our optometrist will say, your astig is 1.5 diopter. But the machine says it's 1.73. So it's a bit more precise lah. So it's more, the accuracy is. So people with higher power, higher astigmatism, we go for customized LASIK. And of course, it'll be more expensive.
And berapa perbezaan cost dari segi this?
About, I think, if I'm not mistaken, it's about 7-8K per eye.
There's an extra 1,000 or 2,000 to consider.
Extra,
okay.
Yeah.
Based on spending the extra, how much of difference they're going to see in terms of your...
If your power is not high, let's say your power is like just 200-300, I would say just go for the basic one lah, cukup already. Because see, let's say your astig is 1.25 and the machine checks is 1.30. Would that practically make any difference to you? Practically no. Okay, so even if your power after LASIK is like 25, then previously was 300-400, you'll still be happy.
Understand. Because peningkatan or the difference, perubahan sangat-sangat ketara
already. Yes, correct. So that's why I say sometimes if your power is low, your astig is low, basic one is good enough already. Like my own nephew and niece, I did both of them. I did the basic one. And they're happy. Good vision back again. Yeah, and most of them have very high power, and or at least about 400-500 power. And if you can make them power like 25 or 0, they're very very happy already.
Dan adakah kalau seorang tu mungkin pada jangka usia yang muda did the LASIK, and then maybe dalam lingkungan umur 50 tahun 60 tahun mereka dapat cataract?
Yes.
Does it impact the
cataract is different. Cataract,
I know, but it really impact the lens at one point? No.
Normally those people like those like very high myopes, they tend to get cataract early on pun. So so if let's say they have never done LASIK, okay, and they come and they are 50s, they say, "Ayo doctor, I fed up already lah pakai spec, pakai umur sejak 14 tahun, 15 tahun, umur secondary school already sudah pakai. I want to do LASIK now when I'm 50 years old." I will say, "Sorry lah, you're too late already, but we can do a lens implant." Okay, that means you don't have cataract, tapi kita buat operation macam cataract. We call it a refractive lens exchange. Okay, and put a multifocal implant. Because the newer technology now also is in the implants, as I was telling you. So nowadays we have this trifocal implants. Those days we would say, "Oh yeah, you ada cataract baru buat." Nowadays we say you tak ada cataract pun we can still do, but because you don't want to wear glasses, not because you have cataract is bad.
Okay, faham.
So the difference is there.
And also like because yang doktor cerita tadi pada awal, there will be individual patient yang akan datang ke to the center, to clinic, to the clinic pakar ni. Dia akan datang, dia akan tanya, I want to do this laser with their opinion. Pada pemikiran mereka, okay, I ada issue ni, tetapi mungkin they have to do actually a lens implant.
Yes.
Apa cost to do a lens implant with their perspective of coming in entry point of doing LASIK? Mungkin they're going to spend like 6,000 ringgit to the top max. The basic entry.
Okay, first thing, let's say when you do LASIK, your cornea thickness must be enough.
Okay.
Let's say like the cornea thickness is below 500 microns. So I would say technically I cannot do LASIK for you. Okay, it's but there's not enough of cornea tissue. Okay, but let's say the space there, we call it the anterior chamber depth, is quite big enough. It's about 2.8 and above. Then we can put the ICL implant. Okay, there's one ICL is one brand. There's another one called IPCL. And there's a third one now called MCL, sorry. So these are different companies lah. So it's like one Toyota, one Honda, one like that. So these are all are called phakic IOLs. IOL stands for intraocular lens. So phakic IOLs, these 3 brands. So if the space is enough, we'll go for the implants. Let's say they are young 20s ke early 30s, we can go for the implant. Of course, cost-wise, LASIK is cheaper. Implants are more expensive.
How high can they get?
Okay, can go up to 8-9K per eye. But if let's say their astig is high, then it may go even higher. Because then we have to do like customized made lens. Those are customized made lens for them. So those are even higher. Okay. Then if let's say we have patient cannot do LASIK, cannot go for phakic IOL, then third option lah, we call it like the refractive lens action. That means we take out their so-called cataract, walaupun dia tak ada cataract, tapi just because the power is extreme, like 1,000 or something. There are some of my patient power there 1,003, 1,005, 1,008 also got. I've seen one patient 2,000 of glasses power.
Wow.
So those people without glasses, they are practically blind. Okay, so even like I had one patient from Melaka, if I'm not mistaken, power 1,005, 1,006. Do the refractive lens action.
And this happened at what point age?
They about 30s, 20s, So I've even done one lady, she's only 22, 23 years old. But she can't do LASIK, she can't do the phakic IOL. So I say, you do the third option lah. So, and she's so happy. She bangun pagi can see the world.
Nice.
The best thing about all 3 patients, either is phakic IOL or LASIK or the refractive lens action, doktor bangun pagi I boleh nampak dunia. If kalau tak, first thing, mana I punya spec?
Betul. Jangan bangun tanpa melihat dunia. Don't be blind. When you can have technology, I think kita kena adapt to the technology that exists lah. Dr. Azhar, before we wrap up, thank you so much for being here today. any final message or advice to the followers Lesung Batu Medic Show or the public, Malaysian public secara amnya on this kind of therapies? Apa nasihat?
Okay, first thing I would say, don't be scared. Basically most people are scared of pain lah, sakit. Don't worry, we will anesthetize you properly. Okay, second thing, technology has improved leaps and bounds. Okay, those days everything was just LASIK. Nowadays we have other options. Okay, so come for assessment dulu. We won't straight away operate pun. Okay, come for assessment. See what are your options. Okay, then you go back and read about it. See, if you think you want to go for it, go for it. Because end of the day, everything also has its own risk. I always tell my patient, you datang sini naik kereta kan, balik rumah boleh guarantee tak ada accident? Tak boleh kan. Tapi we will drive carefully, we follow the rules, we wear our seat belt, we don't go against the traffic, So same thing, we have our own SOP, safety precaution. Despite that, if things want to go wrong, of course there's always that risk, but the risk is very, very, very minor. Nowadays people are worried, guarantee me this, guarantee me. There's no such thing. You are willing to take the risk, you go for it. My own family, 4 of them did LASIK. My 2 sisters, my nephew, niece. My nephew, niece, memang I did myself to them. So if it's not safe, I wouldn't have done for them. Okay, so I think that's saying good things about that. Really.
I think apa Dr. Azhar tu kata memang benar. Risk factor memang tetap akan ada dalam apa-apa jenis rawatan. Tetapi kita kena pastikan that kebaikan ataupun manfaat tu betul-betul melangkaui, terutama sekali dalam rawatan terapi refractory, dalam segmen ophthalmology, kepakaran mata dalam bidang perubatan ni. Teknologi mereka kalau kita lihat tu betul-betul mikroskopik. Yes. They memang guna kanta and a lot of gadgets yang kita sometimes saya pun kagum lah. How do they actually slice this?
To tell you a slice story lah before we wrap up. I had this one lady, I think 35, 36 years old, contact lens user. Every day wear contact lens. Every month she spends about 300 ringgit to maybe more. Then she did LASIK with me. After that she said, I wish I'd done this about 10-15 years ago. I'm spending 300 ringgit every month unnecessary. This is so much more easier.
Yeah, of course. Dari segi the cost impact, I totally agree. I 100% agree with you. And also the safety impact means you don't have to think about the sanitation level, the safeties,
and of course we will clean the eye and everything. Of course,
I mean on the specialist perspective, and also on their daily consumable usage is another one more thing. The position they have to make sure they put the lens and the contact lens betul-betul and everything. So kita jangan hold back in terms of teknologi kerawatan. Bukan hanya dari segi masalah kepakaran mata, even dalam pelbagai jenis rawatan yang wujud. Teknologi exist and sistem kesihatan ni semakin lama semakin akan update. Mungkin satu hari nanti mungkin kita hanya akan buat rawatan dengan gunakan AI, computer and modelling and everything. Benda-benda tu is already coming, and we cannot deny it's going to be in our doorsteps very, very soon. And at one point we will embrace everything.
Actually, even in eye now we have a bit of AI inside our treatment already. Because like those days we do LASIK or even let's say the lenticular extraction called SMILE. We do now is called CLEAR. That one has a OCT. OCT stands for optical coherent tomography. That means you will scan the eye on real time, see where we want to make the cut, see the eye got movement or not, and we will adjust it. Those days tak boleh adjust. Nowadays we can adjust during surgery. So that's why I think things are better and better now.
The leap is like just bound lah.
We can talk about hours and hours on that, but I think we don't have enough time for all that.
Okay, anyway. Before we wrap up again, Dr. Azhar, thank you so much daripada Vista Eye Specialist. Dr. Azhar berkhidmat dekat klinik pakar mata di Bangsa South. Okay, for those people who need any therapies, you can search untuk Dr. Azhar Zainuddin online. Mesti boleh jumpa dia. Kalau ada apa-apa soalan, mungkin they can ask you or come for a consult.
Can, no problem.
Okay, sehingga kita bertemu di episod yang akan datang. Jangan lupa like, subscribe, follow Lesung Batu Medic Show on YouTube, TikTok, Facebook dan juga Instagram. Sehingga kita belum bertemu di episod yang akan datang. Kita lesung kau-kau.